Everyone, it's good to see you all again on Einstein's Eyes, our YouTube channel. John and I have been doing this now for a while. The channel is growing, but we really appreciate subscribing. We need all the help we can get. So thank you in advance. I'm Carl Rosen, oculoplastic and neuro-ophthalmology fellowship trained in Pittsburgh with Jack Kennerdale, and now in Anchorage, Alaska, doing my thing here for the good folks of Anchorage and Alaska in general. And John?
Hey everyone, my name is Jon Ditkoff. I'm a general ophthalmologist specializing in the cornea. I've been in northern New Jersey for about 30 years now. Carl and I trained together at Albert Einstein. It's good that we stayed in touch, and now we have this wonderful YouTube channel for your education.
Yeah. So I'm not sure I mentioned this, but I heard recently that Albert Einstein College of Medicine got an injection of $1 billion.
Yeah, they're free tuition.
Unbelievable.
Yeah, free tuition.
Unbelievable. Imagine if he was still there, John.
That's amazing.
Those we would have had free lunches more often.
Nah, but we weren't. I mean, it was really more for the med school.
Yeah, I guess you're right. Yeah.
We have friends. I have a friend that's a student there right now. He immediately found out he just saved, hundreds of thousands of dollars. I mean, in tuition.
That's unbelievable. That's unbelievable. Wow. Well, congratulations to Albert Einstein College of Medicine. And here we are. Today's topic is pterygium. And pterygium in Greek, I believe, is known as wing. And you'll see why shortly. But John, who's our anterior segment cornea fellowship trained expert, is going to talk about pterygium. And I'm looking forward to his thoughts and his comments. John?
Yeah, so we titled this video "Growth of My Eye" because that's what it is. It's basically a growth on the conjunctiva, overlying the conjunctiva that grows over the cornea. It's a fibrovascular growth, usually in a sun-exposed area. It's called actinic exposure. So it's very common in people from South America, Puerto Rico, lots of sun exposure, the Philippines. It's very unusual to see it in people that grew up in the Northeast, but I have seen it in some patients, including my mom had it.
Yeah, John.
I think you have a good picture, right?
Yeah, pterygium. And again, just to reiterate what John was saying, it's ultraviolet exposure. But have at it, John.
Yeah, so we can see here the pterygium where you are outlining it. It's actually grown over the cornea about 2.5 millimeters. So if it had stopped growing before the cornea, we would call that a pinguecula, which is just we'll have a picture later, but that's a growth that's just on the conjunctiva. That's a different treatment, different plan. But we'll talk about pterygium first. So here's another picture of a pterygium. So there's basically a few problems with pterygia that would bring a patient into the office. One is just the way it looks. Some patients are just, oh my God, what is this thing? And we reassure them that it's not a cancer. It's almost always bilateral. It's almost always starts in the nasal area, closer to the nose. If you did see a person, let's say, that was fair-skinned, light-eyed, that grew up in New York or New Jersey or Alaska, and they had it only in one eye, especially if it was in the temporal area on the other side, you might think it could be even a cancer. So that's when you have to think about that. But most people, and for today's discussion, we're talking mainly about pterygium, which are benign growths. They're not cancers. And typically, we don't have to do anything about it. So if it's 1 millimeter on the cornea and it's not affecting the vision and it's not really doing much, we reassure the person that they should do certain things to prevent it from getting worse and also treat it. So the things that prevent it from getting worse would be protect your eyes from the sun, good sunglasses. Number 2, lubricate, because if the area becomes dry, it can become irritated and inflamed, and that makes it grow. So those are the 2 things we would tell a person with a small growth that's not really bothering them. If it was getting irritated and inflamed, well, again, we treat the dryness first, because a lot of times it's just getting dry. We might use ointments or gels. Sometimes if it's really inflamed, we might even give steroids or anti-inflammatory drugs. But we try to avoid surgery, because the problem with surgery is there's no guarantees when you go to the operating room. So there's at least, if you just remove a pterygium, which is actually pretty simple to do, it's a 5-10 minute procedure, just remove it. We used to do it in the clinic in the Bronx, right in the office, not even in the operating room. And we remove them. The problem is there was about a 30% chance they'd come back and they'd be much more aggressive. So we really stopped removing them on their own because it was such a high risk of it coming back. So what we do now and over the last 30 years is we remove it and then we'll do something to prevent regrowth. So that can range from using something like mitomycin, which is a chemical which prevents growth, or more commonly, I do what's called a conjunctival autograft, where I take tissue. So remove the pterygium, I remove it from its area, I clean it up and make sure it's really beautiful and clean. And then I take tissue either from the person's eye in a different location and I just transplant it, or I take tissue from the person's eye and I just transplant half of it. So I relocate part of it and I stitch it in. Or we also use what's called amniotic membrane. We have a video about amniotic membrane if anyone that wants to watch it, but that's tissue we get from the placenta of a woman that had a baby. And we take that from the lab and we actually stitch it in. So with any of those techniques, the concept is you decrease the rate of regrowth to about 10%. So it's still a risk of it coming back, but it lowers it dramatically. So in my opinion, if you're going to have a pterygium removed, you should almost always do something to mitigate regrowth other than just removing it. And that's it. That's pterygium in a nutshell.
So John,
Pinguecula, you have a slide about. Oh, you want to ask some
yeah,
questions about?
yeah. So I wanted to add one thing. So there's a trend now. I don't do a pterygium excision, but when I did it years ago, I was reading that the trend now is not to use sutures, but to use fiber and glue, because the
True.
sutures are inflammatory, and fiber and glue. You know, we
Good
use in
point.
oculoplastics when we do. I used to work with neurosurgery. We would do craniotomies, dural tears. We would
Yeah.
use Tisseal or fiber and glue to seal the dural tears after a big panfacial trauma, you know, a car crash, that kind of thing.
So yeah, there's two answers to that. Number one, if you're doing a conjunctival autograft, which means you're taking tissue from that person's eye, you really need to suture it. Glue won't work. I mean, I've cauterized a lot of it to prevent too many stitches because it's a quicker procedure. It's a lot easier. But the second thing is, so glue is definitely used for the amnion. Amnion definitely, but there is a risk. I mean, I've glued amnion and it fell off. So
Yeah,
it's not quite as holding as suture, but it is more elegant and cleaner. And like you said, less inflammatory. So you have to kind
yeah,
of weigh those things.
yeah,
The other problem with amnion is it becomes very costly.
yeah,
Uh,
yeah.
amnion,
But
the insurance
yeah,
company doesn't like as much as me using the person's own tissue.
right, right. So there is a word of caution here. I think the take-home message is go slow, treat it medically first. Surgery
Yeah.
can be very helpful, but there's a high rate of recurrence. So I would think carefully before I jumped in. And John, as you're mentioning, there's also a growth called a pangueculum, which some folks believe is a precursor to a pterygium. We're going to show this right now. You would argue that, I suppose?
Yeah, I mean, I do think it looks similar, and it's also seen in the same population. So it's definitely actinic exposure from the sun, and it's seen more in people that grew up in southern climates. Uh, and for whatever reason, pinguecula sometimes just stop growing, and sometimes they continue to grow. Do you have a picture of it? You want to
Yeah,
show
here we
that?
go. Here we go.
Right, so this is a pinguecula. So you can see it's a fibrovascular growth, starts in the same location as pterygium, but it stops. We monitor those people. Pinguecula patients sometimes come in freaking out. What is this growth on my eye? What is this thing? And you have to reassure them and tell the person it's probably been there for years and you just didn't notice it a lot of times. I try to point it out to patients that weren't aware of it so they don't, have some emergency where they call up 2 o'clock in the morning, they just suddenly noticed it. So pinguecula and pterygia have a similar problem where because they're elevated, they tend to dry out and they get inflamed and they get irritated and red and swollen. And you can get what's called episcleritis overlying that, which is inflammation. So, but I treat that the same way as regular old inflammation, lubrication, non-steroidal anti-inflammatory, things like Motrin, Aleve, in an eye drop form or even orally. But if you have a patient that keeps getting recurrent inflammation and you try all these medical options, then you consider surgery. But as I mentioned before, surgery does have the risk of it recurring and going back and being more aggressive. So you'd rather not do it. I've had many patients come to me wanting these removed because of the cosmetic aspect. And I really discourage it because I'll tell you right now, I've done thousands. And even with experience, and I think I have good hands, The problem is it's not really in my control. I can do beautiful surgery and everything looks very beautiful at the end. But if they get regrowth, it sometimes looks worse than you started with. So I don't like to do it for cosmetic reasons. I don't like to do it just because it bothers a person or they get occasional irritation. The indication to remove a pterygium is when it's growing onto the cornea enough, like that it's coming close to the pupil, where it's either causing decreased vision or it's about to cause decreased vision. That's when you really have to go in because you have no choice.
Right. You get astigmatism.
Oh, yeah.
Yeah. So the other thing, John, is differentiating a pangueculum or pterygium from a cancer.
Yeah.
And I mean, that's probably another topic, but ocular surface neoplasia or squamous cell, carcinoma in situ, those types of things, they do look different, but sometimes it's hard to tell.
I
And
have many patients. I think I was alluding to it before. I think if you see someone with it, it's in both eyes, it's in the nasal quadrant, and they grew up in Puerto Rico, you're not really concerned. If they grew up in the Northeast or Alaska or someone like that where the sun exposure is not much and it's in one eye and it's on the temporal side, I would definitely biopsy that. And
yeah,
then there's that in between. I have patients that have had only one eye in the nasal area. Maybe they were in the sun a lot. They visited the beach a lot, and that's where it's a tougher call. And in those patients, it's tough. I might get a second opinion. I might just monitor it with pictures and topography. And if it's growing, then remove it. But those patients, I will remove it earlier on, unless I'm convinced it's a benign pterygium.
yeah. So, I mean, you don't see a lot of squamous neoplasia,
It's
but
very rare.
right. But when you do,
I've
it
seen
looks
it.
angrier to me. It looks more aggressive. And,
Yeah.
you know, your clinical judgment really raises your spidey sense.
Yeah.
And in those cases, I do send it off. And then it's a bigger deal because then you have to do cryo or take wide margins.
Oh, yeah.
And
That's a big deal.
that's another topic. But John, thanks for that. Anything else you want to do before we wrap up?
No, that was great. I think we hit on the most important things of pterygium and pinguecula.
Yeah. So like we said, pterygium, you want to be conservative, hold your horses, I would say, when considering surgery. But if necessary, if it's affecting your vision, causing astigmatism, then by all means, talk to your ophthalmologist about that. And thanks, everyone. Good to see you all. Please subscribe and like, and we will see you on the next video. So long.